It's July 20th, 2012. The School Board of Menominee Falls is having 2015. You're right. I don't know why I said 2015. It's having a special meeting to discuss healthcare carriers, and I'm going to let Carrie Brust lead the discussion.
Okay, so Jeff Gross and I worked with our benefit consultant to look at different third-party administrators for the health plan for the 2016 plan year. When the evaluation came down to it, we looked at renewing the current contract with Humana or going with UMR. The positives with UMR, the change over to that is we have the ability to replace services that are in place currently aren't happy with and have difficult functioning with processing our current plan as is with the third-party administrator of our FSA and HRA plan, including retiree billing. They have a great service model. They have a dedicated service team for our employees. So instead of having the person who calls in get whoever picks up the phone first, we have a dedicated team where those calls would be routed and questions. So people who are very familiar with our plan will be answering those questions. The service model for the HR team, we also get dedicated representatives to us to help us work through any elevated issues that we may have. So that's a nice offering to us as well. We have decreased fixed costs if we move from the new Humana renewal, the decreased maximum financial liability. That's really if we hit the aggregate portion of, or 120% of our expected claims for this coming year. We do get a 1-year implementation credit of $15,000. We did not factor that into the cost because that's not a renewing credit that we get, so it's a one-time, along with a 1-year wellness credit of $10,000 to be used any way that we would like to do in that first year. There's a 3-year rate guarantee on the administrative fees, and we also get the exclusive pricing that AFG has negotiated with Optum to take advantage of that, and they specialize in self-funding. The negative with UMR is, well, there's administrative changes. There would be disruption to our employees in doing that, but hopefully it would be a smooth transition, but there is that change. The investment it would take for the implementation is a big undertaking, so we would have to make sure that we have capacity to complete that and be successful at that. There is a new network and mail order system. Mail order is something that's really very personal when it comes to prescription drugs and our employees and their dependents. So although we haven't always had positive feedback with our current mail order, I'm sure changing is something that employees would not look forward to for that one. We have to set up a new EDI interface with our online enrollment system, which is benefit ready. And we need to make sure that they can do that. They're not currently working with UMR at all right now, so that we'd be the first ones developing those electronic data interchanges for them for the online enrollment. And then also leaving Humana, we would be paying run-out fees, which is about 3 months of service fees that we would be paying for claims that would run out that they'd be processing from the previous benefit year. Moving on to
explain that again?
We'd have that anyway.
Yeah,
okay, so it's not incremental. It's just
it's a one-time.
It's basically the new insurance carrier doesn't want to take on the risk of paying out without doing the actuarial component.
So that's a one-time fee that we'd be paying. Humana, the positives is there's no disruption for the network or prescription of what our employees are currently using. There's the decreased administrative changes for the members and learning the new TPA, like the online portal. Network consolidation, so this year, starting January 1, the High Performance Network and the National Point of Service Network will be combined into just the National Point of Service. So there'll be one network option. The employees wouldn't need to make a choice, which would make things more simple for them in doing that. And there's, renewing versus implementing a new TPA. It takes away from the time investment that's needed to do that. Administration is familiar to the district, along with there's a new service model that Humana is now offering where they'll give us one dedicated team member that we go to, and that team member will be responsible for working with whoever they needed to within Humana instead of calling this person for claims, this person for COBRA, this person for, whatever. And then we do have more time to evaluate plan design changes and other healthcare costs that we would have for plan year 2017. So that would buy us that. The negative is there's a higher stop loss in premiums and attachment point. Replacing the vendor that does our FSA and HRA is we'd have to do that some other way. UMR can provide those services for us. Right now, that's not something we can do with Humana. Prior service levels, there have been concerns with both the implementation of Humana and renewal, along with the service that our employees have received and responses from them. And overall, there is a higher cost with Humana that way. So,
what's the TASC? Is that that's third party, so that's a separate cost to us, right?
That's task. That would be the administrator of our FSA and HRA plan.
So how much is that? Is that a big number annually to have that service that would now be not in the other if you switch?
I believe it's like $3.90 per member per month. That's enrolled with the HRA plan. The FSA plan is very similar to that.
How much? $4?
Right about that, yeah, $4 would be a safe number to use in looking at that.
Does that get charged to the employee?
No.
Okay.
Roughly 14,000, 24,000.
Okay.
That's
So
assuming
that's a
we-
consideration. That's
they
another
all use it.
contracted fee we have to deal with, right? Okay. Great.
So I just want to clarify a couple of things I thought you said. So when you opened it up, you were talking about Humana and UMR, but there were 5 different vendors that were originally spoken to. 2 didn't match our provider network, and so were not considered. That left 3 that went through the process and bid, correct? And your recommendation, it was to look at Humana versus UMR, and so you discounted the other one, which was a higher cost than UMR.
I had a question. Under the negative for UMR, you show new network and mail order. Do we know what the percentage of plan members use mail order currently with Humana?
Our employees are incentivized to use mail order. They can, at retail, our plan, they would get a 30-day supply. If you go mail order, you can get a 90-day supply and you pay 2 co-pays instead of 3. So that would be the advantage with that. That's why mail order is something that's really important to our employees because of the incentive to be able to take advantage of that. And the new network, is a near match to what's currently being offered, but it is the concerns that the employees would be expressing going through, is my doctor in there? I have to look at the network, I want to make sure, and really setting up the mail order and
So going back to my question, currently, what percentage of our employees in the plan use the mail order?
that I don't have an answer to. It's something that I would have to get
Can you
into.
take a guess?
Well, I would say likely it's probably about the 80-85 percentile is what I would believe.
Thank you.
Jeff, can you just put that on your list of things to get answers for?
With United, can't you use the local CVS or the mail order?
You can.
Is that not with all UMR or?
You can do that with Humana as well. The advantages to mail order is typically it would be a lower cost to us to be able to use that. And the other part is compliance at retail and medication, which, non-compliance is a huge cost to our plan or any health plan, is about 54%, and that could go all the way up to about 80, like in the 80% of compliance, because that prescription is automatically being refilled and sent to you versus, I'll wait a day or I'll wait a week to go pick up my prescriptions, and that does have an impact on compliance.
And I think you get a longer supply with mail order as well, so there is a convenience factor.
But that is a decision that is made by the plan.
Sure.
It's something that we could change, but it is what's been recommended, so.
No, we have United, I can get it through mail order, I can get it at CVS, and I still get my 90-day supply, so.
Right.
And so that's the plan design.
Now, we were talking about making a plan design so it's effective for 2017, or 2016. We would make a plan design effective 2016. And then with Humana, it's indicating that we would have time and we would wait. Are we eligible, though, if we lock in, and we've talked about the lock-in rates with the UMR, can we make plan designs every year if we change? Okay.
Yep.
And then Pat or Jeff maybe, or Gary, talk about what process we're following, next steps here to lock down a decision.
The intent tonight is to provide the open discussion and to get that posted to the public. And then the action will be at the next meeting, assuming the board is comfortable with the recommendation, and that will be Wednesday, July 29th, if the community wanted to participate in that evening.
Can we, because we all, for the public that will be watching, we have a short evaluation sheet. Can we get this posted somewhere that can be easily found
It's part of, it'll be part of minutes, right? Should be?
Yeah, can
on the website, so that anybody that's interested in looking at this, they can see the evaluation?
Good deal.
Does anyone else have any other questions with regard to the discussion that you would like addressed, so they can bring back to the next meeting, or if they have the answers to them?
So just the timeline, so open discussion, and then we have to decide, this is just carrier change or carrier evaluation. And then whenever that decision is, and that it gets made next week, then what's our timeline to implement, like the big, you know, so we have to start.
Plan design.
The costing structure.
Yeah, no, I'm talking about,
Plan design.
I'm an employee,
Mhm.
so if I make a change, when would I see a change in either plan design or carrier?
January 1st.
So January 1st, 2016.
Mhm.
Okay, so we're talking 6 months,
But they
5
would,
months.
but they would have to make their opt-in in the open enrollment
November,
period.
December.
which is
November.
Okay, all right, just
And
checking.
so all the work has to be done. For those that are watching, all the work has to be done with regard to getting them enrolled and plan design
Right.
between now and
Right.
January.
Okay, super.
Okay. Anything else? Mark, Laura, questions? Michelle? Dave?
No, ma'am.
Ron?
No, we appreciate all the hard work that had gone into this decision, so.
So we will anticipate at the next meeting, which is July 29th, a executive summary and with regard to making a proposal. And if the couple of questions that we have asked become answered and everyone is comfortable, then the vote will be taken at that time. If in between there are additional questions, then we'll have to evaluate at the meeting.
And Dave is indicating he will not be available that evening, so just make sure that the answers go out via email as well.
Okay.
Make sure you have a quorum in case anybody else can.
Yeah,
I believe we do.
we're all
We don't
here.
have- we don't
Everybody's
have-
here.
We don't have anyone else not at the 29th, correct?
Not at this point.
Okay.
Okay.
Yeah.
All right, we have one other item that we need to address in open session. And I'm looking for my right piece of paper here.
You need it?
We previously had a closed session with regard to a personnel issue, and I need someone to move with regard to the following. The direct administration team to complete, the motion is to direct the administrative team to complete the resignation process discussed and approved by the board within closed session.
Also move.
I'll second.
It's been moved by Mr. Turnus and seconded by Mr. Bertieri to direct the administrative team, which would be Dr. Greco and her staff, to complete the resignation process discussed and approved by the board within closed session. Is there any additional discussion? All those in favor?
Aye.
Opposed? Okay, thank you. And that is the end. We don't need to go back into closed session?
No, because now it's.
We're going into
it's
personnel, joint personnel
But we
and
need,
finance.
let's have a motion to adjourn.
So moved?
Second.
It's been moved and seconded. All those in favor?
Aye.
Aye.